Barara. The next panelist I'd like to introduce is Dr. Alka Gupta. She is the Chief Medical Officer and co-founder of Blue Rock Care, a new primary startup caring for seniors in underserved areas. As she seeks to make excellent, comprehensive primary care feasible for all seniors, she believes that prevention and a healthy lifestyle should be at the forefront of healthcare. A clinical assistant professor of medicine at Weill Cornell Medicine in New York City, she was previously co-founder and medical director of the Integrative Health and Wellbeing Program at New York Presbyterian Hospital. Dr. Gupta is board certified in internal medicine, lifestyle medicine, and integrative medicine. Dr. Gupta?
Hi everyone, and thank you, Dr. Azar. I think the term integrative can be a quite confusing term for a lot of people, and it's sometimes used differently. So, I'd like to take a couple of minutes to just chat about that. I got interested in integrative and lifestyle medicine during my training, which I did in internal medicine, because I was taking care of a lot of people with complex problems, and I felt like I couldn't take care of them as fully and as completely as I really wanted to. So, as you might expect, internists take care of patients with pain, with heart attacks, other serious problems, and I was getting questions that I couldn't fully answer. Now, integrative medicine is quite different from alternative medicine, which became popular in the US, especially back in the 50s and 60s, where people were using non-evidence-based medicine instead of standard of care. Now, we know that leads to poor outcomes. And so from there, complementary medicine became more popular, where somebody might, for example, see a primary care doc for maybe back pain, and then maybe they'll go and seek out additional therapies somewhere else to help. So, for example, acupuncture, let's say. Now, it's better than alternative medicine because you're not choosing one thing instead of standard of care, but it can still be a little bit disjointed. The right hand is often not talking to the left. And if somebody's using something with not a great side effect profile, that can lead to poor outcomes as well. In integrative medicine, we really strive to bring in evidence-based therapies that you might not typically find at a hospital system or a regular medical practice into that setting so that people who could benefit from it can have access to that sooner, perhaps, than before. And really, I consider integrative medicine an approach. It's a way of looking at a problem and trying to determine what is causing it, what's contributing to it, kind of like Dr. Barara was saying, addressing the underlying problems with the goal to achieve a better outcome. We can take maybe one common example, like irritable bowel syndrome, which is a very common condition here in the US, essentially where somebody has irregular bowel habits or abdominal discomfort, and we don't have a great answer for why, and it doesn't fit into a specific diagnosis. One approach I often see is, using stool softeners or laxatives or maybe medications that decrease spasm. But on the other hand, we know that what we eat and drink, how we move, stress, sleep, these things are really impactful in IBS. And so a second approach that might be more effective and more long-lasting would be one that addresses those underlying factors. In the same way, for somebody with a history of breast cancer, it might make sense to think or talk about nutrition, physical activity, and the same. The NIH has an institute that's dedicated to describing the science behind an integrative approach, and now most academic medical centers in the U.S. also contribute to integrative medicine in some way, whether it's clinically or through education or through research. So I hope that's some helpful background, and I look forward to talking more and answering some questions later.
Thank you so much, Dr. Gupta. So this next question I'm gonna throw to Dr. Gupta, it relates to the relationship between tamoxifen and joint pain. So I'm wondering if you might be able to address that, but then more broadly, can you just talk about how it's possible for patients to be able to get pain relief using less conventional modalities?
A lot of patients who are going through treatment for breast cancer can experience joint pains. It is a bit more associated with a different class of medications, the aromatase inhibitors, But, we've certainly seen people who experience similar symptoms with tamoxifen. Some people find there is some evidence showing that exercise and actually utilizing joints is probably a better idea than getting less active, which is more often the tendency. And then some people also find acupuncture helpful. The nice thing about both of those is that the side effect profile is quite favorable. And so many people feel comfortable trying them, and then, after several sessions, deciding whether it's effective for them or not. When talking more generally about how we can use different approaches for treating pain, it really depends on what kind of pain we're talking about and what is causing it. That tends to be a common theme that I think we're hearing from all of our panelists who try to understand what is leading to that issue in the first place. And pain is a complex one because there are so many factors that can contribute to how we perceive it and how we experience it. When we think about pain pathways in a very traditional and very simplistic sense, we think about it like somebody is pinching my finger or stepping on my foot. That is activating receptors there. That signal is then getting transmitted up that limb to the spinal cord, up to relay centers in the middle of your brain, and then out to the higher, more evolved areas of the brain where we actually sense and experience pain. But we can also all probably imagine two different people that experience pain a bit differently. Like, for example, maybe one person in a situation where they're having their blood drawn or they get their finger pinched, they experience a certain level of pain. And maybe there's a second person who is undergoing the same thing that experiences a much higher level of pain. And that's because there's actually quite a bit of central processing that occurs along the way that's not accounted for by that very simple transmission of that signal. And so different people experience pain in different ways. And when we just think about it in the most simple way, we can understand there are a lot of different places and a lot of different ways that we can interrupt or influence that signal. One simple example that many of us might be able to relate to is most people, when they take their children to get vaccinated, for example, we usually distract them, or people usually distract them. And that's because if you pay attention to something or you attend to something, you're more likely to experience pain at a higher level and also for longer than when you're not attending to it. Acupuncture. We know, I mentioned acupuncture a couple minutes ago. There are suggestions that it may be helpful in decreasing peripheral inflammation when done at certain sites. And we also know that acupuncture stimulates the central nervous system to release something called OLP1, or opioid-like peptide 1, that actually simulates and binds to receptors similar to opioid receptors. And so those are a couple of the proposed mechanisms by which acupuncture can be helpful for pain, both peripherally and then also centrally. Massage therapy can be helpful for some people in relieving muscle tension. And then things like stress or the internal stress response can also influence how we perceive pain. And cognitive behavioral therapy has been long recommended for treatment of chronic pain as part of a comprehensive approach. And therapies like mindfulness and meditation can also be helpful, and the science behind those has only gotten stronger in the last couple of decades. So a long winding answer to say that the right approach for you as a person really relies on understanding what is contributing to your pain, which are within your control at all, and then trying to address those. The nice thing about the modalities that I just mentioned is the side effect profile is quite good. So many of them are tolerated very well by many or most people.
Thank you so much. I really agree with you. It's once you explain to patients how complex the perception of pain is, they do have a better appreciation of just how challenging it can be to treat as well. And the next question I'm throwing out to the group, because I'm not sure which one of you may have the answer. So one viewer is asking about DMSO, used both topically or as an edible, who claims that it helps them with pain as well as sleep duration. Does anyone have any insight or opinions on that?
I haven't really used it in my practice, but maybe a couple of words. It is thought to have, it does have anti-inflammatory activity. It is generally, from what I know, used topically. And it's been used for pain and inflammation in the bladder, and also some signs show that it might be helpful for arthritis, whether osteoarthritis or perhaps autoimmune causes of arthritis. But I can't like summarize the evidence and give a recommendation. So I would just suggest caution if something is not commonly used off-label or is not approved for a certain indication.
So you mentioned that stress and anxiety can contribute to pain. Can you just explain a little bit further about how you usually approach the management of that, perhaps not using conventional, pharmacologic treatments? And then this is my own question. Do you ever incorporate nutrition counseling in terms of a more non-conventional? It should be conventional. Unfortunately, I think we all would agree that it's not yet a part of mainstream medical education.
Definitely. Your first question was about the impact of stress and anxiety on pain perception. And we talked about how pain works a bit. A lot of what happens centrally can be impacted by certain emotions. So to put it simply, when we're anxious or scared or afraid of a certain situation or in a certain situation, or maybe even all the time, we tend to activate certain areas of the brain. We tend to activate more primitive areas of the brain, more lower down areas of the brain that we refer to as the monkey mind, because they're very similar in more primitive animals. Areas like the amygdala and other associated structures. And when we do that and we activate those systems, we literally upregulate, we increase the pain signals that reach the higher levels of our brain. So that is a known effect. On the other hand, with the opposite, so if somebody is relaxed or in a more restful state, we can actually downregulate or decrease the amount of pain signals that go up. And so that's part of the reason that cognitive behavioral therapy has been a long-standing tool to addressing chronic pain. Not acute pain, but chronic pain, once you've been in pain for week after week, month after month, year after year. Mindfulness and meditation, there's more and more data on that having a measurable impact on how we perceive pain. And what we see in people who practice mindfulness on a regular basis, we actually see structural and functional changes in the brain that back that up. So we see people's, the prefrontal cortex, the area right behind your forehead, that's the most highly evolved area of the brain. That's basically what makes us human. It's what allows us to regulate our emotions. It allows us to regulate our thoughts, regulate our actions. And that area actually grows and gets better connected and more active in people who practice mindfulness. And then we actually see that those more primitive areas of the brain, they can actually shrink in volume and get less well connected and less active. So we can see it both at a behavioral level and also at a measurable pain level, and then all the way down to the anatomical side. And those are just things that we can't accomplish through a medication right now or a supplement. To your question about nutrition, that's one of my favorite things to talk about. The way we eat and drink influences so many different chronic illnesses. And if you look at, maybe not as much things that we're talking about today, but if you look at the leading causes of morbidity and mortality in the US, at least 5 of them are at least somewhat preventable by optimizing what we eat and drink every day. So it's a very relevant part of health. I think it lives at the core of health, and it should be in primary care. And so you should definitely seek that out if you're not getting it where you are.
Excellent. Thank you, Dr. Gupta.